So most of the testing that you'll see is like a blood serum test, and the most common one you'll see maybe where it says vitamin D is 25-OH. And there actually are a couple different serum tests that you may find on your labs. The 25-OH is the most common one, and it's a great resource to understand where you're at. And so the optimal range I like to see, and with the evidence too, is around like 50 to 100.
Yeah, right.
I'm pretty picky about it, and I normally want it to be like 60 to 70, like around there. That is just where we find like the most optimal like health as far as like reducing that fatigue and reducing the risk of depression, or again even like brain fog too, which I forgot to mention.
Yeah. And if I may, just
Yeah.
sorry to interrupt for a split second, but we were talking before that number for the longest time, and I think
Oh
there's
yeah.
even still quite a few medical clinics that are still going by this normal as being acceptable, was like 30 or 40.
Hmm.
But if you're telling people like, hey, you're actually going to feel a lot better and perform a lot better and be a lot better if you're closer to 60, then that 30 number is so woefully adequate, is it not?
Yes. Oh
Yeah,
my
yeah.
goodness. Yes. Yeah, it is alarming. I just had a few patients that their levels were like 30 and below, and I was like,
Yeah,
gasp, like,
yeah.
all right, we gotta, yeah, there's something going on. And that's another thing I wanted to touch on is, all right, say you do have a low level, and maybe it is appropriate to do some, supplementation. And I do normally like the vitamin D3 with K2. I won't get into
Mm,
the weeds about that. But it's really dependent on what your level is. So it's not a fun answer, but it depends on your symptoms
but it's the
and on
truthful
the,
answer.
yeah,
It's always going to
yeah,
depend. Yeah.
right. So there may be a loading dose where it's decently higher per week, or it could be that maybe you just want to make sure we're getting those 1,000 IUs a day. For retesting, because we've mentioned over and over that it's fat soluble, so it does take a little bit of time to make sure that we're absorbing that. And so you may not see that levels, immediately increase like you would a vitamin B.
Hmm.
So I normally wait about like 3 to 6 months before retesting.
Yep.
With that, we want to make sure we are absorbing it, because there's a lot of absorption issues. So if there is, say, that you have, like we mentioned, it's fat soluble, and we need like bile salts coming from our liver and being stored in our gallbladder.
Yeah.
There can be other like gut dysfunctions, we'll say, where if you have the autoimmune condition of Crohn's or diverticulitis, if there's
Hmm. Hmm.
overgrowth in the gut, in the small intestine, it can be a really difficult time to absorb vitamin D. So this is where we want to peel back the layers and understand, okay, we're supplementing with vitamin D. Why in the world are we not increasing when I retested in 3 months? So we
Hmm.
want to get a little bit deeper. And of course, there are some like medications, even if they're short term or long term medications, that again your prescribing provider can discuss with you as well. But the most common ones are steroids and statins and diuretics, and laxatives. So we just want to make sure and collect all of that information if you are supplementing or trying to get through food or UV lamp exposure. That's one I love too.
Right.
So yeah, just connecting all of those dots.
Absolutely.